Hello, my name is Haley Green, and this semester I completed my internship practicum at the Alabama Department of Public Health in the Infectious Diseases and Outbreaks Division. My immediate supervisor was Dr. Sherry Davidson, the interim state epidemiologist for Alabama, and the primary mission of this division is to ensure the health of Alabama's residents by monitoring and investigating cases and conditions of zoonotic, environmental, and infectious disease. The goal of this internship originally was to conduct a geographic analysis of tick-borne disease cases throughout the state. However, when we were made aware of our first positive COVID-19 case on March the 13th, I began working with the COVID-19 pandemic response team at the state level. I'm very fortunate for this experience, despite our unfortunate circumstances that we're currently under, because it was truly able to teach me applied epidemiology in a real-life scenario. So in the beginning, I assisted with completing case investigations, which consisted of several different steps, but the most important step, which many of you may be aware of, is the contact tracing process. So during this process, we would inquire where this individual has traveled to or who they've came in contact with, starting 2 days before their symptom onset date, signifying their infectious period. So then we would reach out to their contacts so that way we can mitigate the spread of COVID-19 throughout the state. This task became too much for us to handle by ourselves at the state level, so we did enlist the help of our district investigators throughout Alabama, which we are very fortunate for. So moving forward, I was able to begin assisting with manually entering lab reports into our ALNBS system. So ALNBS is our Alabama NEDS-based system. So NEDS is National Electronic Disease Surveillance System. And so this system is vital for not only conducting case investigations, but also monitoring disease. And it's a great data collection tool for us at the state. So not only was I able to enter in positive COVID-19 lab reports and assist with helping our team with that responsibility, I began educating hospital CEOs, healthcare workers, and lab facilities on the importance and the law to report this notifiable and reportable disease in less than a 4-hour time period electronically. Throughout this process, I learned that many facilities in the state were not only aware of this law, but they were unaware that of the other reportable diseases and how they should be reporting those to us in such a timely manner. So I'm thankful that I was able to provide that education. And I do look forward to seeing how, this can benefit us in the future by just simply educating our facilities in the state on the importance of not only receiving accurate lab reports and demographic information, but also doing so in a timely manner. So this task became too much of a burden for myself to handle, as I was working sometimes until 12 in the morning after working all day entering in lab reports. No one asked me to do this, but it felt like a responsibility that was placed upon me that I didn't want to really cause any delay in the entire system. So when we were able to bring on a lab report entry team, I was very thankful for that. And so I assisted with training these individuals. And in the final products that I've attached a Q&A that I've distributed among everyone, along with being in contact with them 7 days a week and answering any questions or concerns that they had. So not only was I able to take on those responsibilities, I also conducted surveillance for healthcare workers and hospitalized patients in the state. That way we could keep track of who we are providing guidance to, and which I believe was extremely beneficial. And so fortunately, we were able to automate that system. After approximately a week, someone on our team wrote SAS code, and so this system fortunately was automated so I can begin devoting more time to the lab report entry and the lab report entry team. So as the team began assisting with the responsibilities of lab report entry, I was also able to learn a new software program, new to me, called SATScan. So SATScan is a free public software developed by the CDC, which is used to analyze spatial, temporal, and space-time data. And so this software can be used to detect signals of possible clusters of disease. And so we're still working with this software to determine if it's feasible for us and if it will be useful for us moving forward. And so I'm continuing to work with this agency and reassessing this almost every single day. And so we do run this program and try to see if we can pinpoint any significant clusters. So it's been an extremely informative experience for myself. So all of these responsibilities taught me a lot, and I'm very thankful for the knowledge that I've gained from this all, especially as I continue working as an epidemiologist at the state level, studying disease patterns and conducting surveillance for general infectious diseases. That's all I have. So if you have any questions, please feel free to reach out to me. I would love to speak more about this one-on-one or in any manner in the future. So I do thank you all for watching this video, and I do wish you all the best at this time. Thank you.